Today's video will see the differences between type 1 diabetes mellitus and type 2 diabetes mellitus. So now before going to the differences between type 1 and type 2, what are the various other types of diabetes mellitus that we know of? So these are the types. First is type 1 diabetes mellitus, which is also called insulin dependent diabetes mellitus. The second type is type 2 diabetes mellitus, which is called the non-insulin dependent diabetes mellitus. The third type is maturity onset diabetes in the young. In short form, we can write it as MODY MODY. The fourth type is metabolic syndrome, which is also called syndrome X. The fifth type of diabetes mellitus is latent autoimmune diabetes in the adults. In short form, we can write it as LADA. The sixth type of diabetes mellitus is fibrocalculous pancreatic disease. In short form, we can call it FCPD. And the last type is gestational diabetes mellitus. Usually we see in the pregnant woman. In short form, we can write it as GDM. Among all these different types of diabetes mellitus, today we will compare only the differences between type 1 diabetes and type 2 diabetes. So in type 1, the age of onset is usually childhood or adolescence, and in type 2, the age of onset is usually above 40 years or adults or in adults. Now what is the cause for type 1 diabetes mellitus? It is destruction of the beta cells of pancreas. So beta cells of the islets of Langerhans in the pancreas are destroyed. The cause may be unknown, which we call idiopathic, or the cause can be either autoimmune destruction of the beta cells. So what happens when the beta cells of pancreas are destroyed? The insulin production is inhibited. There is no production of insulin into the bloodstream, which is the reason for severe hyperglycemia. So once again, in type 1 diabetes mellitus, there is beta cell destruction, lack of insulin production, but there is no insulin resistance at the peripheral level. Now what is the cause for type 2 diabetes mellitus? In type 2 diabetes mellitus, the beta cells of pancreas are functional, which means the insulin production is normal, but the insulin cannot act at the peripheral level because of resistance at the insulin receptor level. So once again, in type 1 diabetes mellitus, the beta cells are destroyed and there is no insulin production. In type 2 diabetes mellitus, the beta cells are normal, producing normal amounts of insulin, but there is insulin resistance at the periphery or at the tissue level. So in type 1 diabetes mellitus, what causes destruction of the beta cells of pancreas means usually GAD antibodies, the autoimmune antibodies, which are called GAD antibodies. In full form, we call them glutamic acid decarboxylase antibodies, which act on the beta cells of pancreas and destroy these beta cells, so the insulin is not produced in type 1 diabetes mellitus. But in type 2 diabetes mellitus, as we said, beta cells are normal, they are not destroyed, insulin is produced. So in type 2 diabetics, we don't see the GAD antibodies. In type 1 diabetes mellitus, as we said, it is the destruction of beta cells, so insulin is not produced, but it is not the problem with insulin resistance. So when there is no insulin resistance, we don't see insulin resistance markers in the type 1 diabetes mellitus. What are these insulin resistance markers? They are nothing but acanthosis nigricans and skin tags, usually seen at the back of the neck and usually at the waist level. Once again, in type 1 diabetics, we don't see insulin resistance markers. But in type 2 diabetes mellitus, insulin is produced normally, but because there is insulin resistance at the periphery, we see the insulin resistance markers in these patients, which are acanthosis nigricans and skin tags. Another difference in type 1 diabetes versus type 2 diabetes, in type 1 we see diabetic ketoacidosis. So you can see ketone bodies in the urine and all. But in type 2 diabetes mellitus, usually we don't see the diabetic ketoacidosis. And as everyone know, diabetic ketoacidosis is life threatening. So in type 1 diabetics, if you see diabetic ketoacidosis, immediately you start treating the patient. Another difference, in type 1 diabetes, because there is lack of insulin production, you see severe hyperglycemia in these patients. But in type 2 diabetes mellitus, insulin is present but there is only insulin resistance, so you usually see the fasting hyperglycemia in type 2 diabetics. Now, what are the symptoms in type 1 diabetes mellitus? The most important symptom you have to note is weight loss. The other symptoms are polyuria, polydipsia and polyphagia. Because there is weight loss, the patients are usually very lean but not obese in type 1 diabetes. On the other hand, in type 2 diabetes, it is not always a rule that obesity must be present in type 2. Obesity can be present or can be absent in type 2 diabetes mellitus. And to check for obesity, instead of using the body mass index, the more better indicators are waist circumference and weight is to hip ratio. Another significant difference between type 1 diabetics and type 2 diabetics is that in type 1 diabetes you don't see diabetic dyslipidemia. On the other hand, in type 2 diabetics you see what is called diabetic dyslipidemia. Now, to describe the differences briefly, in type 1 diabetes you see lack of insulin production, you see GAD antibodies, or in full form glutamic acid decarboxylate antibodies, you see diabetic ketoacidosis, you see weight loss, and because of weight loss the patients are very lean. And in type 2 diabetes mellitus, the insulin resistance is present. Because insulin resistance is present, insulin resistance markers like acanthosis nigricans and skin tags are seen. You see fasting hyperglycemia, and most importantly you see diabetic dyslipidemia in these patients. Now let's talk about this diabetic dyslipidemia. The diabetic dyslipidemia in type 2 diabetic patients is the main reason for atherosclerotic cardiovascular disease. And as you all know, atherosclerotic cardiovascular disease is life threatening. So whenever you come across a type 2 diabetic patient, so you order for the fasting lipid profile, which must include HDL levels, triglyceride levels, very low density lipoprotein levels, low density lipoprotein levels, and also most importantly small dense LDL levels. The small dense LDL levels are the main reason for the formation of atherosclerosis and the reason for the cardiovascular disease in these patients. And as you all know, HDL is good cholesterol, LDL, VLDL, small dense lipoproteins are the bad cholesterol, right? Bad lipid profiles, I mean, right? So whenever you see decrease in HDL levels and increase in the other parameters like triglycerides, VLDL, LDL and small dense LDL levels, immediately start controlling this dyslipidemia in order to prevent cardiovascular disease. Thank you.